All right, so let's talk first about aging of the skin. Now, aging of the skin is one of those things that really takes a long time to treat and is not really treated well with any surgical interventions. There's not a surgical silver bullet that's really going to take care of skin aging. Skin aging happens and is the result of an accumulation of years and years of sun and environmental damage. Everybody knows about ultraviolet light. Ultraviolet light leads to chronic inflammation, leads to telangiectasias, which are little blood vessels that are in the skin, and accelerates the loss of skin elasticity. This loss of elasticity is really what causes the wrinkles and the signs of aging that you can see externally. Additionally, things like nicotine will decrease blood flow in the skin, which results in the loss of skin elasticity, which also occurs just as a general process of aging. Now, to turn back the clock really means minimizing wrinkling, not totally eliminating it. And this is where a lot of patients can get frustrated, that they think that coming into the office and getting skincare treatments, spending money on skincare products is really going to eliminate their wrinkles. And that really isn't a realistic goal. Really, the goal should be to minimize wrinkles over time, not totally eliminate them. Now, the other place that we kind of get confused, that patients can kind of get confused, is that pulling on the skin, which works in the mirror, is going to work in real life. And unfortunately, that really just doesn't work. Pulling the skin that doesn't have any elasticity is like trying to pull on an elastic waistband that has lost its stretch. It may look good for a short time, but after a very short amount of time, that elasticity and lack of elasticity is going to show up with things drooping and sagging. Your pants that have lost their elastic stretch are going to end up around your ankles. Your skin that's lost its elastic stretch and you pull on it is going to end up just sagging again. So pulling the skin that has lost its elasticity is doomed to fail unless we do something else. So this is why we kind of go after skin treatments as a totally separate entity that is separate from surgery itself. Now, what are those treatments?